Hey, friends, can y'all hear me out there? Happy Monday. It is Monday. It's Monday, and it is our time to do what we do because every Monday we is in here getting it together, okay? Let me see. I'm going to go ahead and share my screen. But how was your weekend, friend? What did you do this weekend, huh? What did you do? Did you go anywhere? Did you do anything special? What did you do this weekend? Remember, as you chime in, come in the room. Hey, friend, I see y'all come again. As you come into the room, make sure that you are telling us where you're calling from. Or I always say where you're calling from, like we're on the radio. Child, this is 2024, honey. We are not on the radio, but we are live. Okay. So, where are you joining the live from? Hey, Lena, that girl named Lena. Hey, Lena, welcome, welcome, welcome. Happy Monday. So this weekend on Friday, we went and we had fried fish. I love fish. If you didn't know, I am a pescatarian, so I mainly eat fish and seafood, and then I eat, vegetables, but I don't eat chicken, pork, beef, turkey, none of that. So I always try to get me some seafood. So we had seafood on Friday, and then afterwards, hey Paula, afterwards we went to Taylor Swift dropped a new album on Friday. So then like where we live, they had like a DJ that was playing live music and stuff like that. So we went and listened to the music and hung out outside. It was pretty nice and cool on Friday here in Houston. So we went and did that. And then on Saturday, what did I do? Oh, I went to a brunch on Saturday, like a networking brunch, and I met some beautiful women who are doing some amazing things in the community. So that was pretty cool. And then on yesterday, I cooked. Yes, honey. I fried some shrimp for myself, and then for my family, I fried chicken wings, red beans and rice, cornbread, green baby. Okay, it was a Sunday dinner, and everybody who ate enjoyed it. Okay, because baby, we like to eat. All right, food. They say home is where the heart is, baby. Food is where the heart is. Okay, the best way to show somebody you love them is by feeding them. Okay. So when I come to your city in your town, feed me, okay? Let me know. That's why I'm like, okay, Paula, you in New York, Lena, where you at? Because baby, as we travel, I might need to come and say, okay, where do I need to eat? Show me where the good food is. So that was my weekend. I had a good weekend. I ain't tripping. I ain't complaining. I'm here with you. It's a Monday, and baby, we getting it in. Today we are going to be talking about like drugs and things like that. So this is going to be a good one if you struggle with the nervous system and you struggle with just memorizing the drugs and things like that. Okay, Lena, you in Orlando. Okay, cool. Cool, cool, cool. So when we get ready to come to Disney World, I'm gonna say, hey Lena girl, we on the way. We on the way. What is it? Universal Studios, I think. Yeah. All of the things. I'm watching your videos to study for my exam. When are you taking your test, friend? When are you taking your test? May 15th. Okay, what are you using to study for your exam? Because May 15th will be here, maybe in like what, 3 weeks? Maybe in about is this your first time taking it? Please feel free, y'all, as you come in, make sure that you are asking all of the questions that you need to ask because this is what these sessions are for. I know y'all like to come and see me and talk to me, but ask your questions because this is what these sessions are for. They are for you to ask questions. I told y'all last week about the self-taught 4-week online course that prepares you for your certification exam. In the self-taught, you can purchase the program, begin the course online, and everything you need is there. Okay, everything you need. You don't need to buy another book, anything like that. All of the materials are included, and then also we do accept Afterpay. So if are saying I can't afford this, go and look at it. Afterpay is in there. 99.9% of people are approved for Afterpay, and then that way you can take the class and you can get started. Class is going to start May 6th. So you have time to enroll. The deadline for this class is going to be this Friday, April 26th. So if you are enrolling, make sure you're doing it. This is the self-taught class. So this is where people are saying, hey, I don't really need an instructor. I don't really need a coach. I can manage myself in this class. Okay. So this is a great opportunity for you. It will also monitor your progress, because a lot of my friends who are studying on their own, they're studying, but they don't know where they are. They don't know if they're returning the information, or if they are just watching the videos, or if they're just reading this information, but it's not sticking. So in this class, you will see where you are and if the information is actually sticking and making sense. And then for my friends who are looking for someone to walk them through the program and walk them through the retention of the course, and want to make sure that that course is actually sticking and that they can pass their board exam on the first try, because y'all know, baby, that's what we do. We first timers. Okay, we first timers. We pass on the first time. All that back first take. Okay, we Stephen A. We first taking here. Okay. I used to watch First Take with my husband when he, would be home. We would watch First Take, and so baby, we first take. Okay, we real first timers. And so that means we passed the board exam on the what? First time. We ain't doubling back. Never spin the block. What you spinning the block for? Do it right the first time. You ain't gotta do it a second time. But so yeah, with that being said, this one here will walk you through. And what's the difference between this one and the self-taught class is this course comes with an instructor, and you meet with your instructor twice a week for 60 minutes via Zoom. So in that class, you get to ask questions, you get to engage with the instructor, you get to ensure that that you are understanding exactly what is going to be on the exam. You can ask those questions. You can even get a breakdown of calculations. A lot of y'all struggle with calculations. You can get a breakdown of that in those Zoom sessions. And again, the deadline for enrollment is going to be April 26th, this Friday, April 26th. We do accept Afterpay. We do accept payment plans. We also have tuition assistance. So if you need any type of support, it is here for you. If you haven't received the support, it's because you didn't say nothing. Baby, because closed mouths don't get fed. You over there needing some help and you just sitting there looking. I always tell people, if you are trying to get something you've never had, you need to partner with someone who has what you want. It makes no sense to keep trying to get it and you don't know how to get it, because if you knew how to get it, you would already had it. So, sometimes you just got to do what you need to do. What's the cost for the course? This course here is $850 for the instructor led, but if you're doing the self-taught, that is $499. $499 self-taught, and then instructor led, where your instructor is teaching you and you can ask them questions and things like that. That's $850, and that course is going to end this Friday. The deadline ends this Friday. When you purchase this course, all the material for the course is included. You don't purchase a book. You don't do any. You don't need any other materials. If you are looking at me right now, that means you have Wi-Fi, and that means you have an electronic device. That's all you need. Everything that is included in the course you will receive, and then at the end you will receive a certificate of completion. Because remember, and you get the certificate of completion for both courses, whether it's the instructor led or the self-taught. Now remember, when you get ready to take your board exam, you have to show proof to the PTCB that you've completed a recognized program. Our program is recognized. So if you have not done that, you taking your exam and you don't have that to show, then you you are, you're gonna, even if you pass and you don't meet all of the requirements, then you won't be able to receive the certificate. I've had that happen. I've seen that happen to friends. They take the test, they pass. They've been watching my YouTube channel and they pass because they was watching my channel. But then when the board asked them, okay, what pathway are you completing? They don't have the certificate to show. And so guess what happens? That pass that they just got is null and void because now they have to go and complete a class. So make sure you know what's required before you jump in. Miss Paula, if you take a screenshot of this information, you'll have it. And then also, if you click the link in my bio, you should have it there. But what I will do is I will link it here. I will link it here so that way you all can have that. And let me get this up for you so that way I can drop this in the chat. So if you all need it, you can have it, because one thing about it, as you are moving through, and you want this information, it's always good to get it when you see it. You know what I'm saying? Because it's easy for us to go on about our life and then we forget about things. So let me make sure I put this in here right now. And then I'm going to come back to the I will come back to the live. Let me share my screen. And I'm dropping this in the chat so anybody can see it, and make sure that you take advantage of it. I'm also finna put it in the chat so you can see it. It looks like it's a little long right here. So let me see something. Hold on. Give me 1 second, because that is a little long. I have another way that I'm going to share this with you, because it is important that you see it. So I'm glad that you're asking for it, so that way 2 other people can get it as well. Make sure you take a screenshot of this information. And what I will do, since we are right here, I've shared with you all before too, and I don't know if everyone knows this, but here is our online store, and I have 5 different things here for you. Okay, so I also have my study guide. If you are not enrolling in the course, you can use the study guide to help you prepare for your exam. Lena, this study guide would be good for you because you're taking your board exam in like 2-3 weeks. And then we have other courses here. We have the instructor-led, the 4-week self-taught, the CHW class, which we've had that since 2018. And then we have a dual certification course where you can get certified as a CHW and a pharmacy technician. All of our classes are under $2,000. None of our classes are over $2,000, and we've done that to make sure that education and career workforce training is accessible to everyone. Okay, so there again is no reason why you should not be successful or have the life that you desire. Okay, here is the link. You can go ahead and take a screenshot of this, add that information to your phone, so that way you can make sure that you are seeing everything that we're doing, and you can be a part of it if you choose to do so. Okay, again, these classes do come with a certificate of completion, so it is very imperative that if this is something you desire, that you are putting yourself in a position to be blessed. I tell people all the time, we pray and we ask for stuff, and then when it's time to get it, we don't know how to reach for it. Okay, we don't know how to reach for it because we too busy caught up in what we used to do. Baby, what we used to do, what we should have did, what we could have did, where we used to be, all of those things are gone. Yesterday is gone. Today is here, and tomorrow we don't really know what's going to happen. Okay. So take advantage of the opportunity while you can. The other thing I want to mention to you all, and I'm going to step away and get my water real quick. But the other thing I want to mention to you all too is that once you become a certified pharmacy technician, the next step, if you chose to do so, is to offer a pharmacy technician course yourself. And so, what I'm doing, and this is a new service that I have started, now I am teaching my friends who are certified technicians how to open and how to offer a pharmacy technician class to their community, to their peers, to the people in their area, in their states. Because one thing about it, pharmacy technician has been the gateway for me to enter into entrepreneurship and business owning. And so if that is the desire of your heart, if that is something you want to be, you can do this. But the first step is to get certified. Once you decide that you want to do this, click that link down here. And once you click the link tree, it will take you where you can set up a coaching session, and you and I can get together and make sure that you have what you need in order to open up your pharmacy technician course and start offering the program in your area. So a lot of times when people are looking at pharmacy tech, y'all are just thinking about retail. Y'all are just thinking about working at Walgreens and Walmart and all of these places. But baby, building wealth can start by working for yourself. This doesn't have to be a full-time hustle. You can do this and work part-time doing something else. And so again, it's all about positioning yourself for success. It's all about putting yourself in a place where you can receive the best of the best. And if you are thinking about entrepreneurship, business owning, you've always wanted to have a business, you just didn't know what to do. You're thinking about residual income. What does residual income mean? That means income that you don't work for. That means income that comes to you when you sleep. Because baby, if you got to work every time to make money, then you're not making the money is making you. If every time you can't get paid until you provide a service, you're trading your time for work, you're trading your time for money. That's what work is. You go to work 10 hours a day and you make $100 an hour, that's $1,000, but you're trading your time for it. Residual income is where you get to keep your time and you make your money. These are the things that we need to be thinking about outside of just passing the board exam. There is more to life than just going and working for someone else. Take a picture of that link below and make sure you tap in, because this is your time. I told y'all at the beginning of the year that this is leap year. This 2024 is a leap year. We won't have another leap year for 4 more years. And that means that this is your time to leap. You better leap for it all in all capital letters, because that's what I'm doing. And if you coming with me, we running and we winning. And that's why we have the winner circles, because we don't lose over here. We win. That's what we do. Now, I want us to look at Tosh. Look at what Tosh said. Girl, you are the truth. Better than reading the book. Baby, we gonna come in here and we gonna win. We gonna put it together. We gonna make this thing work for us and us not work for it. It does not serve us to be in the space that we were in last year before last. We are changing by the day. Life is changing by the day. Prices are changing by the day. Things are growing. If you're not growing, then you are stagnated. If you are stagnated and you're not growing, that means that you are not moving ahead. You're in the same space. No, ma'am. No, ma'am. We're going to end that, okay? Shout out to Tosh. Everybody say, welcome, Tosh. Welcome, Tosh, to the winner circle. Yeah, this our new friend. Her name, Tosh. Tosh 2873. Yeah, Tosh is working on passing her board certification exam, and she is using our channel to do it, friend. Okay, now if you've been with me, you know I've been doing this since 2014. It'll be 10 years in October. I told you last week, if you're going to follow somebody, you better make sure that the fruit is there. Remember, I told y'all, I said, look, let me come up close. I said, if you watching somebody and if somebody is telling you they can do something for you, check their fruit. It doesn't mean that you're a gold digger. It means you're a fruit inspector. If you telling me that you can help me get something, then that means you had to have helped somebody else get it, or maybe you have it yourself. Don't tell me what you can do if you ain't got it. You better check the fruit. You better check the fruit. Don't let them lie to you, friend. Don't let them lie to you, okay? Because that's what people will do. They will sell you a dream every chance they get. They will sell you a dream. And it is up to you to be what? Fruit inspectors. Now, when you look at this exam study, now I have people tell me all the time, Lindsay, I don't know how to study. I get lost up in the studying and I'm not exactly sure what I should be studying, if I'm doing the things the way I should, so on and so forth. It is recommended that you study the guide 2 hours each day, dividing your study time into 4 increments of 30 minutes. How many minutes? 30. What you need to do, set an alarm on your phone. Set an alarm on your phone. 30 minutes, bam, bam. Put it on there, 30 minutes, bam. Set that alarm, friend, because what is going to happen when you are studying is you will begin to think about other things. Y'all listening to me right now, and I guarantee you, you have had at least one thought about something that ain't have nothing to do with what I'm talking about. I know y'all laughing, and you like, yeah. And it's because the human brain, they talk about the attention span of where we are right now because of the technology and all of the access we have to things. Baby, you could be eating something right now and be thinking about what you're going to eat for dinner, especially if you got kids and a family to feed. So it's important that you are giving yourself 30 minutes of study time at a time, and you break it up into 30 minutes. So if you do 30 minutes 4 times a day, that's going to give you 2 hours of study time a day. If you do that 7 days a week, that gives you 14 hours of study time for the week. Now you're being intentional. If you sit at this table and you at your kitchen table, your bed, or wherever you like to study, child, and you just sitting there looking at that book for an hour and a half, and you like, no, I'm finna study. And you just sitting there, and while you sitting there, you done read the same sentence over and over and still don't understand what they're trying to tell you. And it's because you're not retaining that information. Be true to yourself, friend. You know you don't have the attention span longer than 30 minutes, and it don't take all that. Get this little study guide. You can get it on Kindle. Download the Kindle app first. Go to Amazon, pay the $19.99, and then you will have a copy of this study guide, and it is an unlimited copy. You will keep it forever, and if you ever need it again, you can use it, okay? Now, if you already have Kindle, then it's free for you. If you already have Kindle, then it's free for you, okay? So these are just different ways. I have made this thing so easily accessible for you to where you can't say, well, I don't have a opportunity to get this. I don't have the support. I don't have the resources. I don't. Baby, if you don't have $20 to invest in yourself, then something is really wrong. Then you got a whole nother problem. Y'all said, oh, she coming with it today. And is because it got to be said. It has got to be said. Okay, friend. So now we're going to talk about the nervous system. Let's jump into the lesson. This is some good information, and I'm excited about this one today because so many of y'all struggle with memorizing the drugs. And a lot of that is because of the way you're trying to retain the information. Okay. The first way that I want you to listen and open up your ears, okay? We got to get the sugar daddy out our ears. The Tootsie Roll. Open up the ears, turn on your learning, your listening ears, bam, turn them on. I used to do this when I used to work at the daycare. I used to work at this daycare called Primrose. And if you have children, you may know what Primrose is, but Primrose was the daycare I used to work in. I used to work with the little babies. And when we got ready to talk about instructional time or whatever, we say, turn on your listening ears, and they get to turn them on. And then, when you start talking, they right there crisscross applesauce. That means that they're sitting Indian style, and they're right there to listen. And then if one kid was not listening, we're saying, "Oh, can you help your friend turn on their listening ears?" And they said, "Yeah, come on, Parker, turn on your listening ears." Okay, so make sure you got your listening ears on. The word STEM, this is how you're going to memorize these drugs, and this is the easiest way to do this. When you think about the nervous system, I want you to think about anxiety and panic attacks. Anxiety and panic attacks, depression, all of those affect the nervous system. When I was growing up, I used to hear the people say, "Oh, you're making my nerves bad." Are you on my last nerve? And you just think people are saying that just to say it, just because it's a saying, but they were truly experiencing some sort of anxiety or stress or whatever. So when you think about the nervous system, you think about anxiety and panic, right? Now, the drug class for nervous system drugs, one of the drug classes is benzodiazepine. Write that down. Benzodiazepine. Okay. Now, benzodiazepines are drugs that are used to treat anxiety and panic. Anxiety and panic. So, all of your anxiety drugs and all of your drugs that treat panic disorders are all going to be classified as benzodiazepine. So, you've already learned that information. I'm about to show you how you're going to remember these drugs. It says that the side effects for benzodiazepine drugs is they may cause drowsiness, and we should avoid alcohol. Now, when a person is on some sort of benzodiazepine, if the drug is already causing drowsiness, do you think that that person should be drinking? Do you think that they should be drinking if it's already causing a level of drowsiness? It's like you already sleepy. So now you're going to drink. It can intensify whatever effects that the drug is having or the drug may be causing them to feel. By the way, if this is your first time coming, please make sure you subscribe to the channel and like the video, share the video so it can get into the algorithm. Like the video so other people can see it as well, friend. Don't be selfish, okay? Make sure you subscribe to the channel, ring the bell for notifications so when I go live, you will be notified and you won't miss any content. Drug class, benzodiazepine is one of the common drugs that you do see given in the pharmacy. Now, I found something today that talked about health anxiety. Health anxiety. And health anxiety is something that I have struggled with before in the past. And I think it's because, how they say, girl, you can be too smart for your own good. Child, because I know all of what I know about, drugs and the medications and health, sometimes this is a transparent moment, and I may be by myself on this, and I'm okay with it because I'm the only child anyway. So I came by myself, I'm gonna leave by myself. And most of the time, for the most part of my life, I have been by myself. So y'all ain't got to be with me on this. But if something happens in my body that I'm like, wait a minute, let me look this up. And then when you go to Google and you ask Google what it means if your left hand is tingling, or what's a common thing that people may deal with, if you have a back spasm, they may say, child, oh, that means that your back is out of whack, and you probably could have this. This is a simple one. And it just take you down the it take you all the way down the thing. And then before you know it, you done got off Google, and now you think you got back cancer. Google will have you planning your funeral, okay? And so health anxiety is a true thing. It really is. And it can make people nervous because, especially when you are one of those people who are always taking in a lot of knowledge. When people tell me that they are using multiple things to study for one exam, it always alarms me because I'm like, how are you using one thing? How are you using multiple material for one exam? I never get it. It's like eating Chinese food and a hamburger at the same time. They both may be good to eat. They both will get you full, and they both may be satisfying, but do they work together to meet the current goal? Why are you overworking your brain and you're getting meals from two different people for one reason? It never makes sense to me. And when I think about health anxiety or any type of anxiety, a lot of times, especially with health anxiety, it's because you have this overload of information. So when friends start telling me, well, I have test anxiety, and I'm like, well, what does that mean? What does that look like? And where do you think that comes from? And how can you fix that? Because it's one thing to identify and recognize what you have, but it's another thing to identify it and use it as a barrier or a crutch. You are the creator of your destiny and your faith. You are the one that is in charge of where your life is headed. And so, yeah, you may be praying and you may be believing, but there is still a certain level of accountability and responsibility you have on your end in order to get to the goal that you desire. And that's just the honest truth. And so when you think about, okay, health anxiety, these things are real, and I'm not minimizing it because, like I told you, I've struggled with health anxiety as well. But there is also that level of consciousness that kicks in to say, okay, how realistic is this? Does this actually matter? Does this actually work right now? Why am I using 15 different study materials? Why am I reading this book and that book? If you continue to confuse the brain, you will continue to confuse the pathway, and then you get those results that you don't desire because we're here, there, everywhere. We're like Dr. Seuss. And just think about that for a moment. You need balance, you need structure. We as people, we need that. And sometimes we have to outsource that in order to be successful in the space that we want to be in. And when you think about the nervous system, anxiety is a part of the nervous system. And so are these drugs here. So when you look at Xanax, Valium, Ativan, there are a few things I want you to know about this and write this down. The first one is all of these drugs are categorized as control schedule 4. Control schedule 4. All of these drugs are C4s. Control schedule 4. Okay. That means that they are allowed 5 refills within how many months? How many months? 5 refills within a 6-month period. 5 refills within a 6-month period, okay? Now, when those 5 refills are allowed, if a person turns in a prescription January 1 and they have refills on it, they need to get the refills filled by May 30th. Because come June 1, that prescription is expired. Okay, after June 1, that prescription is expired because they have to receive those refills within a 6-month period. Okay, you need to know that. So you got 5 refills within the 6-month period. These are Schedule 4 drugs. Okay. So that means if they are Schedule 4 drugs, is there a level of abuse here? Is there a potential level, a potential for abuse here? What does it mean when they're Schedule 4 drugs? Does anyone know? Does anyone know what it means when they are a Schedule 4 drug? Hey, friend. Sorry I got here late. That's okay. Does anyone know what it means when it's a Schedule 4 drug? That means that there is a level or a potential for abuse. Okay. So remember that. The next thing I want to show you is how you can remember these drugs. Now, if you remember on the previous slide, the word stem is AZEPAM, azpam. Okay, I might have mispronounced that. And I want you to remember this because anytime you see a drug ending with this type of word stem, I want you to think, oh, nervous system. And then I want you to think, oh, it's a benzodiazepam. And do you see the AZE here and then the AZE here? Those are the correlations to let you know that these drugs are connected. It is connected, okay? And so now when I look at this one, oh, look at that. There it is, azepam, lorazepam, diazepam, alpralazam. You hear that, how it's all coming together, making sense, okay? Alpralazam, diazepam, lorazepam, okay? Those are in the generic name. You are going to see that they are connecting. Now, our brand names are in the apostrophes, parentheses. Sorry, not apostrophes. They're in the parentheses, okay? Xanax, Valium, and Ativan. Now, when you get into the pharmacy and you're taking this board exam, most of the time it's going to be these drugs will be referenced by their generic name and not their brand name because it's cheaper in the pharmacy to carry generic and not brand. Okay. And most of the times the insurance company wants to pay for the generic and not the brand because they want the patient to try the generic before they try the brand. Now remember, the doctor can request the brand and so can the patient. And sometimes you may have a patient who say, well, I'm not going to use insurance, I'm self-pay. And they can do that. They can have insurance on file and decline not to use it, and decline the insurance and use self-pay, and however they choose to take care of it, that's their business. Okay. Now look at the Xanax and look at it very closely. I want you to know this. This is a scored tablet. And what makes it scored is the lines that you see here. Okay. So ultimately, Xanax can be broken into 4 different parts. And when the tablet is scored, that means it is okay for the pill to be broken, because when it's scored, it's saying each part of this medication holds the same amount as the next piece. So this half holds the same amount as the second half. Okay. So you have where you have these drugs, and this is what I want you to know, because baby, when I was little, my mama would break up the pills. Okay, she would break up the pills, and she would say, "You can take half of it. It ain't gonna hurt you." That's her favorite line. It ain't gonna hurt you. It ain't gonna kill you. And now that I'm in pharmacy, I know that, child, when you break it and it's not scored, you run the risk of taking more than half. It breaks down the medication, and it really can destroy what the medicine is supposed to do in the body. Okay, child, and baby, look, I grew up in the late 1990s, well, in the 90s, early 2000s. Okay, um all that stuff that these parents be doing now, back in the day, baby, your mama and them just told you. And if you had a mama like I did, some of y'all younger, some of y'all older, some of y'all the same age as me, and you know, our parents wasn't doing all of what they do now. Okay, it was, baby, you can use that. That's not gonna hurt you. And some of y'all out here still doing it. Okay, and I ain't mad about it. But when you look at these pills, this is a scored tablet. So that means that if the doctor says, and let me tell you how this happens. This is a 2 milligram medication, 2 milligram Xanax. So the doctor may start the patient off taking 2 milligrams, right? And if they're taking 2 milligrams, the doctor may say, okay, well, we're going to cut your dose down. And instead of you taking, the full tablet, I want you to take a half a tablet a day. Okay. And then they take the half. So now they didn't take 2 milligrams. They took what? 1 milligram. You better be smart. You better come in and be smart. Okay. That means they take 1 milligram, friend. If the doctor say, I want you to take 1/4, come on, come on, come on. That's why you gotta know your little fractions. And if you cooking in the kitchen, this past Sunday, I had my youngest son, he's 10. I said, I want you to help me make the cornbread. So he came in, and cornbread calls for measurement. So you're gonna need some milk, you're gonna need an egg, you're gonna need some oil. And if you bought a little box stuff, it's already made. Now, if you're going from scratch, then that's different. Okay. Even then, you still got to do some measurements. So anyway, he came in, and he made a little mistake. And I said, okay, well, that's fine. You did it. So now you use a 1/3 cup when you're supposed to have used, well, whole, 1 cup, but you only use 1/3, and 1/3 has 30 milliliters, and 1 cup has 240 milliliters. So how many of the 1/3 cups do you need to use in order to get to the 240? Yes, ma'am, baby. We was in the kitchen doing math, and he figured it out. And he said, I think he told me, okay, well, I think I need to add 8 more. Okay, the cornbread came out good. You got to use every moment. Can you please teach us how? Oh, wait a minute. Great to know your useful YouTube channel, my guidance. Oh, thank you, friend. Can you please teach us how packaging in retail? Teach us how packaging in retail. What do you mean packaging? Like packaging the medication, counting them on a counting tray? Because in retail, you are putting them on the counting tray and then putting them in the vial, putting the top on it, putting the label on, and passing it down to the pharmacist. So tell me a little bit more about what you're thinking about, friend. Tell me a little bit more. Y'all, did we talk about everything on this slide? I think we did. I think we did. We're still talking about the nervous system. So the other common drug in the nervous system is lidocaine. lidocaine, and you see that it ends in cane. So anytime you hear look, I just got distracted because when I was growing up, they had this song called Hurricane, but you can call me Slurricane, Slurricane, and then it goes into something else. But every time I hear Kane, I think about that song. And if you have heard that song, I don't even know. I know hurricane is the right word, but that next word, I might have made that up because I was young. But anyway, child, lidocaine is used for numbing. So if somebody is using lidocaine, that means that they're having some pain and they're trying to numb. So when you think about Oragel, look at her. Something going on with her chin or her tooth or her cheek. She got something going on. Look at her. She holding it. She looking like she a little uncomfortable. Make sure you explain what you're talking about with the retail packaging, okay? Because I want to answer that question before we get out of here. But yeah, look at her. Something ain't right. So people put Oragel to numb the pain, put some topical lidocaine to, before. So when I got ready, okay, so let me back up. I had that, what is that thing called? That implant, that birth control implant. Child had it and did and gained weight, so couldn't lose no weight on that doggone thing. What was it called? It was the implant, but it had the Nexplanon, something like that. Nexplanon, and I had crazy migraines on it too, y'all. Oh Lord, have mercy. But anyway, they put it in my arm, and before they got ready to put it in my arm, they numbed me, and they used lidocaine, and they numbed the area, and then they made a little incision, and they put it in my arm. So when you think about lidocaine, you think about numbing. And I want you to know that the word, so anytime you see something ending in the cane, Caine, y'all see that in that green? Anytime you think about that, I want you to, when you think about this, I want you to think about numb. Now, it's telling you that there is no known interactions with light drinking. So if a person is using topical numbing, they can drink is what they're saying, but don't get drunk. If it was me, child, I wouldn't do nothing because you already, you know how I feel when you finish getting that dental work done and you can't feel your cheeks, and then they tell you be careful, don't eat anything, hard, don't eat anything heavy, because they know you can possibly be chewing on your cheek and not know it. Ooh, ain't that something? This is what it looks like. So lidocaine, they can, roll it on, like that little roll-on deodorant. When I was little, my mom used to order the roll-on deodorant from Avon. Do y'all remember that? Does anybody still use Avon and Mary Kay? I never really used Mary Kay, but I did know a lot of people who were selling it. But Avon, we did used to use Avon. Mm-hmm. We did. I mean, how do they work? Inpatient pharmacy. Oh, inpatient pharmacy. So that's going to be where people are staying in the hospital and they are being taken care of by the nurse. So typically what's happening there is they're not necessarily always packaging that up. Sometimes when they bring them the medication, it is in a little cup, and then sometimes it is in a unit dose container. Unit dose container means that this container holds 1 unit. So if the dose is take 2 tablets by mouth every 4 hours for pain, then that means every 4 hours they're bringing them one container that has 2 tablets. In the pharmacy, sometimes those pharmacies may receive it already packaged up, in a unit dose container, and then sometimes they're creating the unit dose container. For the most part, it's coming to the pharmacy already packaged in a unit dose container, because remember, in the pharmacy at the hospital, there are hundreds of patients who are checked in at that hospital, and our job is to dispense the medication when the order is prescribed to ensure that the patient get it within the allotted time. So when they are getting that unit dose packaging or multi-dose packaging, that is coming from another pharmacy that is responsible for compounding, blister pack pharmacies. Come on, right? So that's one of the things too, that once you get certified, you can work in those kinds of pharmacies that are pulling and compounding and putting those things together to ship out. When I used to work for this company called Pharmedium in like 2011, 2012. And when I worked for them, it had to be, yeah, like early 2012, mid 2011 or whatever. But anyway, when I worked for them, we compounded IV bags for the hospital. So we would make the IV bags at the pharmacy, that it was a closed door pharmacy. And our job was to compound the IV bags. And then once we were done, they would get rolled into the shipping department. First, before they went to shipping, they would go to quality. And what quality was doing was making sure that the order matched what we created. So it needed to, whatever the patient, or not the patient, the company ordered, the hospital, they would make sure that that's what we compounded. And then from there, it would be rolled into shipping. And then from shipping, it would be sent off. So most of the time, these are the type of pharmacies that are compounding and preparing for the hospital, because the hospital does not always have the manpower, the equipment, or the time to do all of that, because we're trying to meet the doctor's requests. Because remember, there are sometimes that the doctors may have a stat order, and a stat order is to be delivered in 15 minutes or less. An ASAP order means drop everything that you're doing and get this medicine to us now. Because remember, people come in there going into cardiac arrest. They're coming in there, having heart attack. I mean, all these things are happening. And child, we can't be in the pharmacy still trying to put something in a unit dose container. Okay, we're trying to, oh, wait a minute, cold blue, cold red. So that's a great question, friend. Great question. We're still talking about the nervous system. Nervous system. Oxetine and pram. Oxetine and or pram. When you think about the nervous system, remember selective serotonin reuptake inhibitors, SSRIs. Write that down, because these are very common. They treat major depression. And they telling them, baby, avoid that alcohol. Don't get that margarita when you go to that Mexican restaurant. You don't need the sangria, okay? Selective serotonin reuptake inhibitor, Oxetine or pram. Okay, and when you think about that, you want to remember that most of the time, depression is going to be is going to be a part of the nervous system, and we don't want them to drink alcohol. And it's like when you think about the different drugs, paroxetine, and there's another one called fluoxetine. I can't think of. Y'all know I ain't saying it right, so don't be in the talking about. Ooh, she don't know what she's talking about. Okay, just accept the help. Okay, because we're not gonna be great at everything. Okay, it's gonna be some things we're gonna be really, really good at. It's gonna be some things that we're gonna be a little good at, and it's gonna be some things that we're gonna need help with. And that's one of the things I need help with. Okay, so don't come in here judging me. Okay, don't come in here with that. Okay. And if you over there and your friend got something to say, y'all better take up for me, because I've been taking up for y'all. Paroxetine is Paxil. Now, look at this. Oxetine. If you wrote it down, I told you to write it down because I got to keep up. Can you keep up? I told y'all, okay? Oxetine and or pram. So now, when you think about pram, citalopram, Celexa, Lexapro. These are going to be dead giveaways that we are talking about drugs that are used to treat depression. These are dead giveaways that these drugs are used to treat depression. Go, baby. Okay, I'm telling you, we're gonna win, no matter what. So this now you have learned 3 drugs. Okay, so let me tell you, we done covered 10 drugs already. And those are the drugs that I pointed out. But if you are remembering these words, sorry, stems, and these prefixes, infixes, and suffixes, these all right here are suffixes. So you good. But if you are remembering these, when you see them on your exam, you will automatically know, oh, they shouldn't be drinking with this one. This is Paxil, this is Para. Okay, so this means that this is used to treat depression, and they shouldn't be drinking with this. And this is an SSRI. Some of y'all gonna have to rewind the tape, play it back, watch it, rewind the tape, play it back, and watch it. Baby, rewind the tape, play it back, and watch it. If you are with me right now, this is one of your 30-minute scheduled study time. You just got it. You just got it. And if you've been with me the whole time, you done got 2 of them because this has been 57 minutes so far. We're going on an hour. Remember, I told you, friend, you need 30 minutes. And you need to do 30 minutes 4 times a day. Breakfast, lunch, dinner, snack. Okay. What I want to tell y'all about this. I done told y'all pretty much everything. You just need to remember that these drugs are used to treat depression, okay? Again, all of the information that I am teaching you, lovely, amazing, smart friends, can be found in my study guide. It can also be found in my course. And this is something that will definitely prepare you. It is on Amazon. So if you are looking for it, it is on Amazon for $19.99. Download the Kindle app first. And then after you download that Kindle app, you will see your book appear in that app and you will have access to that book for an unlimited amount of time. I do have a print version coming out for my friends who like to see stuff in person and want to rub on it and touch it and feel it. That will be coming out pretty soon. So just keep your eyes out for that. As that hits the shelf, I will tell you about it. Okay, friends. So don't worry. Thank you so much for joining. I love y'all. I truly do. This makes my Monday. And you know what? I told y'all last week that every time I get ready, every time I say, you know what, I don't know if I'm gonna still be able to show up on Mondays for them because my schedule is getting busier and busier, y'all. And I'm like, I don't know if I'm gonna still be able to do it. And then sometimes I'm like, am I still helping y'all? Like sometimes I wonder, you know how it is where you feel like, okay, I'm doing this, but is it working? Am I helping y'all? Is it making sense? You know, because my thing is, I feel like I'm good at what I do, but I know that there's always somebody better than you. You know what I'm saying? And I'm just realistic with that. And then y'all say something like, oh my God, Lindsay, I just passed my board exam. I've been watching your videos. Or, oh my God, the information you give is better than the book. Or, oh my God, someone just told me to watch your videos and I'm glad that I did because it's so helpful and I feel confident. And y'all, every time I try to leave, something keeps pulling me back, telling me I need you in my life. You know what I'm saying? Like, look, I can't get away. I feel like, you know, I be trying to leave and then I came and y'all be pulling me back. I mentioned to you earlier, once you become certified, you too can offer pharmacy tech courses. You can help other people get certified. If you want to do that, once you become certified, hit me up. Hit me up because I will definitely, the link is on the screen. Take a picture of that hit me up because I will help you operate and start your course so you can help other people. Give to other people what was given to you. Press down, shaken together, and running over. Okay, friend. And then last but not least, don't leave before we get to connected, friend. Let's stay together, friend. Help me help you. Okay, let's stay together. I went live. I go live on TikTok all the time outside of this. So some of y'all are in here from TikTok, and that's cool. Follow me on TikTok. On there, I talk about something called tech money, and that is basically jobs that are hiring for pharmacy technicians all around the country. We talk a lot about travel pharmacy technician jobs. So if you're interested in traveling the country and you want to get paid while doing it, becoming a travel pharmacy technician is a great way to do that. A lot of people think about travel nurses, but baby, travel technicians are out here killing the game as well. You can do that if that's something you're interested in. I also talk about, other ways that you can get paid as a technician. So make sure you are connecting with me on TikTok. Okay, my lovelies. I absolutely adore you and I enjoyed our times together. Y'all make my Monday and y'all make me feel like I am helping you. I've never met you in person and I've never seen you in person. You see me all the time, but I've never seen you. If you see me in person, baby, stop me and say, hey girl, hey. Hey girl, hey. Okay. But anyway, let's stay connected. I hope you all have a wonderful week. And I wish you the very best. To my friends who are taking your test this week, make sure you do these three things. You eat something that day that makes you happy. You answer all of the questions that you know first, and then go back and do the ones you don't know. Trust and believe in yourself. As you walk into the testing room, you remind yourself that this test is going to work for me and not against me. You speak greatness. You plan for your celebration after you pass. You can plan for your celebration before you pass, and then after you pass, you indulge in it. Because if you don't set the tone for where you're headed, then you won't receive the things that you desire. Okay. So we have to create an environment to win. There's a certain environment that is needed for healing. If a person is trying to heal from a surgery, they have to be in the space where healing can take place. If they're not in the space for healing to take place, then it won't happen. Okay? And that's one of the things that you have to remember is in order for you to have the things that you desire and the things that you want, you have got to create a space for healing, a space for winning, a space for getting to that next level. Okay, friend? So as you move about your week, speak good into your life and speak positivity because that is what it's going to take in order for you to get to the other side. Thank you so much for watching today. And if you have not subscribed to the channel, make sure you go ahead and do so. I will see you all next Monday, same place, same time. Bye, friends.